All right, so in this video what we're going to be doing is looking over the skull and different parts of our axial skeleton. Now here we have a skull. Now there's two parts to our skull, two sections of bones. We have the cranial vault. Okay, so these are the bones that contain the brain. And we have the face. Okay, so the face is this area of the skull. And then we have the mandible. The mandible is a separate bone. Now, when we look at the cranial vault, we have the frontal bone, okay, making up the forehead and upper parts of the orbits. We have the temporal bone, posterior and superior part of the skull. Then we have the occipital bone, posterior and inferior part of the skull, and then we have the temporal bone making up the side. And now we have two little bones that make up kind of the inside areas here. We have part of it right here known as the sphenoid. All right, so this is what we call the wing of the sphenoid. We can see it a little bit better when we look inside the skull here. Now the sphenoid extends from the orbital canals across the sides and then up the side, what we call the temple of the skull. Okay, so the sphenoid is often called the bat-winged bone because of the way it kind of looks here. And then the last bone that we see here in the cranial vault is the ethmoid. The ethmoid is this little area right in here. We have the crista galli and this area on either side known as the cribriform plate. Now, the cribriform plate has little foramen in which the olfactory nerves go through to your nose for a sense of smell. Now, when we look at the bones of the skull, okay, so here's our frontal bone, okay. Now, connecting it to the parietal bone, we have the coronal suture. In between the two parietal bones, we have the sagittal suture. Between the parietal and occipital bone, we have this lambdoid suture. And these are sutures that form after the baby is born. If you remember talking about this in lab, when a baby is born, there's many soft spots and not sutures. We have soft membranous areas known as fontanelles. And the reason for fontanelles is to provide growth for the brain and the ability for the skull to get through the birth canal. Now, when we look at the temporal bone, okay, so the temporal bone here, we have the external auditory meatus or acoustic meatus. We have the mastoid process. We have the styloid process. Okay, now this right here is our TMJ, our temporal mandibular joint. Now a joint is where two bones come together. So we have the temporal bone and the mandible. Okay, that forms your TMJ. And this little piece of plastic represents the cartilage that we see in there. Now when we look at the occipital bone, okay, so the occipital bone, we see it forming the bottom of the skull. We see the foramen magnum. And then on either side right here, we can see the occipital condyles, where the skull sits on top of the spine. Now, in this direction, we also see the two openings that we needed to pay attention to in the temporal area. So again, here's the styloid. Okay, so the styloid is right there. Okay. And here we have the optic canal. And we can see inside there the jugular foramen. Now, if we turn the skull around, it's a little bit easier to see the jugular foramen. It looks like a very large kidney bean shaped structure. Okay, right next to the styloid process and just behind or posterior to the carotid canal. Now, if we look inside the skull here, again, we can see the sphenoid. We have the optic canals, and this right here is the sella turcica. And inside the sella turcica is where we see our pituitary gland sitting. Okay? And again, the ethmoid bone, here we see the cristagalli and the cribriform plate on either side. Now we can also see the ethmoid bone if we look up the nasal cavity. Okay, so looking inside the nasal cavity, we can see the perpendicular plate of the ethmoid bone on top. On the bottom, this right here is the vomer, and together they make up your nasal septum. Now, these ridges that we see inside are known as the nasal concha, okay? And those are the bones that we see of the cranial vault. Now, in the face, we see the nasal bones. Over here, we can see the lacrimal bone with the lacrimal fossa. The lacrimal fossa is this indentation that we see going down into the nasal passageways. Over here, we can see the zygomatic bone, your cheekbone, and the zygomatic arch. Making up most of the face is going to be the maxilla. Now the maxilla is made up of two smaller bones that fuse together, and it forms your upper jaw. And we see this opening right here just below the orbit called the infraorbital foramen. Now, when we look under the skull, okay, we can see the palate. Okay, so the palatine process, or the hard palate made up of the maxilla, and then we can see the palatine bone, and you can see the line separating the two there. Now looking at the mandible, the lower jawbone, okay, so the mandible, we can see the lower jaw. We can see this area here is known as the ramus. Okay, that's not on the exam, but I wanted to point that out. This part right here is known as the mandibular condyle. Okay, so if we look at this, okay, so there again is the mandibular condyle on either side. That's what forms your TMJ. And inside, okay, so inside, we can see the mandibular foramen. Okay, so on either side of the mandible, there is a mandibular foramen. Now, the skull does have sinuses. Okay, so sinuses, if you remember, are air-filled pockets in the bone lined with mucous membrane. We see a sinus in the mastoid process. We also see a sinus in the maxillary bone, the frontal bone, the sphenoid, and ethmoid. Okay, those are where we find the paranasal sinuses. Now, when we look at the other bones in the axial skeleton, we have the skull bones. Here's the very first, we have the spinal bones, the vertebrae. Okay, this is the very first vertebrae. This is the atlas, okay? This is the second vertebrae. This is the axis. Now the axis is named by this vertical section here known as the dens. Okay, that's the dens. And the atlas will sit on top of the axis and spin and rotate around that dens, or that axis point. Now, a regular vertebrae is going to have some features here. It has the body, the transverse process, the spinous process. It also has this opening down the center known as the vertebral foramen, and that's where the spinal cord is going to go. Now, when we look at the different areas of the spine, we have cervical spine, and you can see the cervical vertebrae here, very kind of dainty, much thinner. This is right here known as the transverse foramen. The thoracic vertebrae, much thicker. Okay, so much thicker body. Okay, if you look at it from the posterior view, it looks like a giraffe. And then we see the lumbar vertebrae, very thick, very rugged, very durable. Same features. We have the body, we have the transverse process, we have the spinous process. And when we look at it, it kind of reminds us of like a moose. Okay. Now, also attaching in front of the spine, we have the hyoid bone. Now, the hyoid bone is a little bone that sits just below your tongue. Your tongue actually attaches to it. Now, the hyoid is the only bone that does not have any articulations with any other bone, so it does not form a joint with any other bone. It's sitting there in front of the cervical spine. It's the anchor for your tongue. Now, the thoracic vertebrae have the distinction of having ribs attached to them, and the ribs are going to wrap around and attach here to the sternum. Okay, so these are the attachment points. These are costal cartilages. This is hyaline cartilage. And we can see the sternum itself. Now, the sternum has three parts. We have the top part, manubrium, the middle portion called the body, and the bottom portion called the xiphoid. Okay, so this is the sternum. Now, the sternum is extremely important because this is where you would apply pressure during CPR, chest compressions, although you do not want to push on the xiphoid because that might push it into the heart, killing the patient. Now, the ribs, as they attach to the sternum, will define whether the ribs are true ribs, false ribs, or floating ribs. So as we look at the skeleton here, we can see that the first 7 ribs are called true ribs. They attach directly to the sternum. The bottom 5 are called false. Now, 8, 9, 10 do attach via rib number 7, but 11 and 12 do not attach at all. Okay, so 11 and 12 are also false, but they're also called floating ribs. Now, the reason that we have them is to help protect the kidneys, which sit right there in front of them. Now, the base of the spine, we see the sacrum and the very tip known as the coccyx. Now, the sacrum, you can see, is made up of vertebrae that have been fused together to form more of a stability or a foundation to the spine. We can see the sacroforamen, which allows nerves and blood vessels to pass through. And that is your vertebral column. Now, in between the vertebrae, we can see the spinal discs, okay, the little shock absorbers, and we can also see this area here known as the intervertebral foramen, in which spinal nerves would exit from the spinal cord. That should be relatively it for the axial skeleton.